The communication entitled Pandemic COVID-19 Perceptions of Challenges by People of Different Age presents an applied research. Pandemic COVID-19 disrupted all areas of people's lives in unprecedented way. Although some of the difficult implications of the pandemic, such as isolation, social distancing measures, reduced possibilities of time management, limited access to preferred occupations and predilections, affect society as a whole. Psychological distress can be worsened for some groups by a peculiar impact of socioeconomic and psychosocial factors. Among the socially vulnerable groups can be mentioned young people up to 30 years old, who do not have a specialty, a job, an occupation, or bear a higher risk of becoming unemployed, have lower incomes compared to other generations. On the other hand, young people are less at risk of developing severe physical health symptoms related to COVID-19 than elderly people, and the lack of access to education and employment can cause them to look for jobs with higher income, professional retraining, or starting a personal business. The support offered to the population in the conditions of crisis caused by the COVID-19 pandemic can be effective, counting on the purpose of increasing not only the economic resilience, but also the psychological ones. The opinion poll conducted online from February 20 to April 24 of this year aimed to identify the changes that have occurred in the lives of the population over the past year, dividing them into challenges and resources. The present communication will present the results obtained by processing the answers given by 356 respondents, presenting the population aged between 19 and 65 years. The survey was attended by 108 young people aged 19-29, 120 people aged 30-44 years, 128 people aged 45-65. Distribution by sex: 275 women and 81 men. From rural localities, 64 respondents, and from urban, 292. Survey participants expressed their views on the changes that have taken place in social relations, quality, and forms of communication in the pandemic situation. Most mentioned that interpersonal relationships were not affected by the pandemic. For some, they become even more intense. However, 142 of respondents indicated a reduction in the frequency of communication with other people. The statistical comparison does not confirm the presence of a significant difference in the appreciation of changes in interpersonal relationships and communication by representatives of different ages. However, young people aged 19 more frequently appreciated the intensity of communication and social relations, or its increase, and more than half of the respondents aged 45-65 mentioned that they do not notice changes in the intensity of communication with others. The most common means of communication in the last year have become social networks, chats, instant messenger applications, followed by the use of mobile telephony. Only 12.4% of respondents communicating more live. The statistical comparison did not identify significant differences between age groups. Most respondents are partially or more dissatisfied with the quality of communication and social relations. The current situation in social relation is more favorably appreciated by the young population, aged 30-44, about 27.9%, considering it satisfactory, and 55.7% partially satisfactory. The statistical comparison did not identify significant differences between the age groups of respondents. By correlating the results, it was established that less intense social relationships directly correlate with more frequent use of social networks, chats, instant messenger applications for this purpose, and dissatisfaction with the quality of communication. Dissatisfaction with the quality of social relationships is caused by reduced possibilities for live communication. 34.8% believe that it has not changed, and 16.9% that the quality of life has really improved, although young people aged 19-29 more frequently stated about the quality of life affected by the pandemic situation. The statistical comparison did not identify significant differences between age groups. Respondents consider as less satisfactory organizing free time, holidays, confidence in political stability, meeting cultural needs, access to health services, sharing the feeling of personal security. The group of young people aged 19-29 appreciate more frequently, 1.52 times more than the other respondents, the decrease of satisfaction with the material financial insurance of the family, the possibility of training and professional development, access to public services, material, personal, and financial insurance. Improving the quality of life is conditioned by the improvement of family relationships, more favorable conditions for improving of individual potential, increasing material, personal, financial insurance, and family, achieving more effective employment rights, the possibility of training and professional development. For young people aged 19-29, there is a greater proportion than for the other age groups, the increase of the possibilities to realize the right to work, the emphasis on the individual potential, the more favorable relations with family. Respondents aged 30-44 indicate the more appropriate emphasis of the right to education, the possibility of training and professional development, material, personal, and financial insurance. The group of 45-65 years indicates the increase of satisfaction with family relationships, but also with training and personal development, the emphasis of individual potential. 25% of the respondents mentioned that during the last year they started to practice exercises to improve their physical condition and health. 24.7% followed professional training courses, and 20.2% applied to bachelor programs, master degrees, or PhD degrees. 70.4% changed jobs or got a new job. About one-third of the respondents aged 13-44 used this period for training in a certain field of work or increased their professionalism. 1/5 enrolled for university studies. 28.3% focused on physical condition and health. 30.3% decided on the birth of a child. 10% started or changed the content of a business. 10% changed their place of residence or improved living conditions. 15% changed their job or they got a new one. Young people aged 19-20 show higher mobility, many of them getting a job or changing jobs, enrolling for university studies. Every 10th emigrated. 22% created a family. Respondents aged 45-65 also used this period to train in a field of work or increase their professionalism, take care of their physical condition and health, start or change the content of a business, change a job or employment. The percentage of those who did not make any change in the pandemic condition is lower for young people aged 19-29. The majority of respondents are worried about the pandemic situation insofar as they comply with restrictions in order not to endanger their health. The greatest worry is in young people aged 19-29, but even in the case of statistical comparison of the results for this item, no statistical differences were identified for age group, sex, or living environment. The population is further disrupted by the restrictions imposed by the Covid-19 pandemic for travel abroad, for theaters, concert halls, online schooling, and university learning, wearing masks in public places, and restrictions for the HoReCa sector, for commercial units and markets. Young people aged 19-29 indicate higher scores of dissatisfaction with restriction 4. Traveling abroad, 83.3%, towards 61.7% and 45.3%. Theaters, concert halls, conducted university education in the traditional way, wearing masks in public places, the activity of the HoReCa sector, the activity of commercial units and markets. The young population aged 30-44 accumulated higher scores for dissatisfaction with online schooling, about 48% and 37.5%. Adults aged 45-65 years for social distances restrictions, 15.6 compared to 27.8%, and 6.7% for 30-44 years. Most respondents are worried about the pandemic situation insofar as they comply with the restrictions in order not to endanger their health, or consider that they have fully adapted to the living conditions imposed by pandemic Covid-19. However, young people aged 19-29 are less adapted to the situation of pandemic crisis. The statistical comparison indicating a statistically significant difference with the group of 30-44 years. Although 45.5% mentioned that they will return very easily to the usual way of life, 29.8% faced slight fears and 15.7% more pronounced about the difficulties they will endure in the post-pandemic period. The statistical comparison identified significant differences between age groups 19-29 years and adults aged 45-65 years. The population aged 30-45 and 45-65 years. The adult population aged 45-65 indicates higher post-pandemic adaptivity scores. The reports established by statistical correlation indicate the negative influence of the pandemic situation, worry on the appreciation of the quality of life. The direct relation between the negative perception of adaptive capacities in the post-pandemic period and the negative appreciation of the quality of life. Indirect interdependence between the ability to adapt to pandemic conditions and return to normal life. The study had two main objectives: assessing the psychological effects of the pandemic on the population of various ages, identifying new perspectives on psychological intervention in accordance with social security measures and promoting mental health. Under such conditions, the professional community of psychologists is to mobilize to identify the resources for adapting the population, engaging in recovery activities that will be needed for a long time after returning to normal. Thank you for your attention.